You're watching The Source on CNN Philippines. I'm Pinky Webb. The Department of Health approves the rollout of the second booster shots against COVID-19 for the general adult population. Only Pfizer, Moderna, and AstraZeneca vaccines will be available during the rollout. Let's go straight to the source of the story. We have health reform advocate Dr. Tony Leachon. Dr. Tony, welcome back to The Source. It's also good to see you, sir.
Hi, Pinky, and good morning to everyone. Magandang umaga po.
So, government has, I guess some would say, finally approved the second booster shot. But to be clear about this is for adults, for the general population. Tell me, what do you think of the timing of this, Dr. Tony? Is it just right? Is it a little bit too late? Or is the public still encouraged? Gusto pa ba nila na magpa-second booster shot?
Well, Pinky, for the general public, it means 18 years old and above. So yung ating kasing dalawang primary vaccines at saka yung ating first booster, ginamit yun mainly for healthcare workers, sa senior citizens, and doon sa may mga comorbid conditions. Now, ito, ating healthy adults are above 18 and then hanggang 50. Ito ba'y huli na? Well, sa tingin ko, pagpaumanhin ng Department of Health at ng HTAC, medyo huli na po ng konti kasi napanis na po yung 50 million doses. At sayang po yun kung meron pong ebidensya dati. Alam nyo, marami na po rin ako nakita ebidensya sa abroad na ginagamit na po kasi yung second booster sa healthy adults. At marami rin tayong narinig na LGU na ginamit po ito. So sana po na i-continue na ibigay kagad natin earlier. Kasi alam naman natin na mag-wane naman po yung immunity natin 6 months hanggang 12 months ayon sa datos sa CDC at saka sa mga scientists at saka experts. Pangalawa, agresibo kasi ang government natin na mag-open na sa turismo. So mas maganda na protektado rin yung ating mga healthy adults. At number 3, though hindi inaamin po ng Department of Health, tumataas din po yung ating positivity rate. Lately, 7% ang positivity rate. At yan ay dahilan sa paggalaw natin lalo na ng Holy Week. So eventually, kailangan din natin protektahan ang healthy adults kasi sila yung mga workforce po natin. Sila yung magtatrabaho. So if we want the economy to be stable and afloat, then we should protect not only the sick ones but also the well ones because they are the ones that will carry the brunt para naman ho yung quality of life as well as the economy will be okay. So those are very compelling reasons and I would agree. Ang isa siguro na I'd like
hold on,
to
Dr. Tony,
right
you were talking
now
about the uptick of cases, no? During Holy Week, umabot na sa almost 2,000. That's about 30% increase from the previous week. Just let me ask you, should this encourage adults now, the general population, 18 and above, to take the second booster shot?
Right. Tama yun, Pinky. Tumaas ang atin pong uptick during the Holy Week. At mas mataas yung namatay na unvaccinated. 13% higher than those vaccinated. Yan ho ang pangalawang datos na gusto ko lang susugyan yung kay Pinky. At ang pangalawang datos, tumaas din po yung mga severe and critical cases. It means to say, hindi pa ho umaalis si COVID. Andyan lang po siya, lurking around, observing. And then when we are not vigilant at complacent tayo, tinanggal natin ang mask, andyan lang siya because we move on to open our economy.
But I guess the question also, Dr. Tony, would be what's available are AstraZeneca, Moderna, and Pfizer. Are these still rather effective? Kasi yung iba, pinag-uusapan na po yung bivalent vaccines. Wala pa ho tayong bivalent vaccines. Ngayon, baka po, isipin ng iba, luma na itong mga vaccines natin, or it's the old generation and not the updated one?
Well, basically, Pinky, you are right. Yung ibibigay talaga sa atin ng second booster or the fourth dose ay hindi bivalent. Ito po yung dati na po nating stocks na mauubos po. But I think the Department of Health naman and the government will not give expiring vaccines. These are actually okay kasi it's morally responsible na ibigay ho talaga yan eh.
Okay.
So wala pa tayong bivalent vaccines at limited ang orders ita. Pero I think meron ho lang akong gustong idagdag. Dalawang importanteng puntos. Ang unang puntos, we should not commit the mistakes of the past that magbabottleneck lang sa LGUs. I think we should mobilize the colleges kasi 18 years and above na ma-deploy doon. And then the workplace because the employers would like their employees na healthy. Number 3, can we use distribution network like the SWE League and then the big pharmacies like Mercury and Watson's kasi closer to the residents' houses so that we can fast-track ito considering we
Okay.
might have actually limited expiry dates.
Yeah. Dr. Tony, just one last question. What about the minors,
Right.
age 12 to 17? Paano ho kaya sila? Is it
Wala
time to
pa.
include them?
They're not allowed pa, Pinky. They're allowed only for the first booster. Oh. I think, Pinky, ang isang importante na gusto ko maintindihan, yung lumabas yung PSA data na maraming namamatay sa heart attack, stroke, at saka cancer. Alam niyo po ba na less than 50 years old, marami po dito. Ang lifestyle diseases are killing right now the younger population. So it's stand to reason that the second booster should be given to all and be accessible or even mandatory. Kasi if you want to protect the young population are getting sicker lang, hindi lang sila healthy adults. And I think that's one thing that we need to consider at this point in time.
All right. Health reform advocate Dr. Tony Leachon. Sir, thank you so much for your time.
Thank you, Pinky, and stay safe.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.